Well, good afternoon, ladies and gentlemen. My name is Christopher here again, and wanted to do another tutorial. It's come to my understanding that I may not be doing a good job with explaining the Ameriplan benefits, coverages, what it covers. So I just want to do another quick tutorial without the accident plan and just dedicate this plan to the Ameriplan product. Okay, now I'm just gonna jump right into it. What Ameriplan is, what it covers, and etc. Features and benefits. So this shouldn't be too complicated. It's fairly easy. So let's just jump right into it, shall we? All right, ladies and gentlemen, Ameriplan is a fee for service discount plan. Okay, what does that mean? Real simple. When you go to the doctor, you present your Ameriplan card after all services have been rendered. Then what happens is that Ameriplan will call. Okay, Ameriplan will call to verify your membership number since they are the provider, and then from that they're able to find out how much your savings is. For example, look down in this corner below here. You can see different examples. His dental card blood test would have been $154. He paid $133. Let's see what else. This person used Ameriplan Financial and they helped increase their credit score. This person had a $500 dental bill. After the dental bill, this person only paid $187. So each case is different, ladies and gentlemen. You have up to an 80% savings on the Ameriplan health discount plan, whether it be dental by itself or the full major benefit package. Okay, so I just want to touch a little bit more as to what the plan covers. So when you have clients that's going to ask you what it covers, you guys can know what it covers. For example, let's make sure we remember the website. Okay, so when you're looking at a product or you're looking to get this product for yourself, just make sure you guys understand what the product covers. So we're just going to go straight down here. Now, a little bit again about Ameriplan. Ameriplan was founded by two twin brothers. They wanted to have more of an affordable service for health plans. And I don't blame them, because even as an insurance broker myself, health insurance plans, traditional plans, will give you quite a bit of an amount per month sometimes, depending on your case. In other words, it can get expensive. I'm just going to be honest with you. Few things to look at, okay, when you're at your Ameriplan deal. You can, getting started, how it saves money. You can, click and read that. It's just an information piece, so I'm not really going to get into that. But the most two important factors when you're looking at an Ameriplan deal, whether you're working with me providing this for a client or a family, or simply you're looking to get this plan for yourself, okay? You can read testimonials. It's going to give you different examples as to what happened with each case, each client, each policy. Okay, so it goes over with you under the testimonial section how much the person covered, or persons, what the coverage, how much you saved them per month. All right, so I would never ever tell a client you're going to have this amount of savings. It varies from case to case. I can tell you that everyone has the ability to save up to 80% in savings. Okay, now when you want to locate providers, you have this option where you can type in what exactly you're looking for. So let's just say dentist. I don't know. Let's just go to urgent physician primary care, since the major benefit service is able to cover inpatient, outpatient, hospital, and physician services, I'm just going to type here exactly what does it look like when you're doing a provider locate type tool. You see here all these options in terms of being able to find a provider that will take the plan. Okay, I didn't cover this on the last tutorial. However, I wanted to cover this on this tutorial. So by you seeing this, you're able to figure out, okay, well, how do I know Dr. So-and-so will take this plan? Real easy. We just simply clicked on locate providers, and this one came up. And this way you're able to look at every single thing you need to. Your dentist, your vision, urgent care, your pharmacies, chiropractic, physician, specialist, ancillary, meaning that will go back like your mental health, diabetes supplies, laboratory, meaning your lab work, imaging, which is your x-rays. That is what's called ancillary care and facilities. Okay, everything else is pretty self-explanatory. I mean, it even gives you a locale type option where you can find any cosmetic surgery provider. So if you've had an accident and you need to find out what exactly is going to happen with the cosmetic surgery, if you're going to have a provider, whatever it is, you can come and find out where you can go. Just that simple. Okay, so let's go back here. Now I want to go ahead and touch on each plan. Okay, as you see, Ameriplan will go up here, and if you guys come to this website, you can watch this video.
Ameriplan is not insurance. We are the smart alternative for the uninsured and underinsured. As a leader of the massive movement in healthcare. Okay,
you guys can come back and look at that on your own time. I really want to use these use the tutorial for explanation. Okay, everything you're looking for, from dental to major healthcare services, this plan covers. We have an enormous array of products, how we can help clients and what will benefit them. The top two products that simply focuses on medical services. Okay, all these plans focus on medical services, but the difference is, I'm gonna repeat, the difference is you get more of a savings benefit tool with the bigger deal. For example, let me show you. Okay, let's go down to this Freedom Pass. Not only do you get the Ameriplan health savings, you receive all these extra savings for your everyday use. Okay, so that's where these come into play. This is the bigger plan. So I want to go back down to what we call maybe the more smaller plans without all the extra, which these are great savings, do not get me wrong. However, I just want to use this for, the point of explaining the health benefits. Okay, so if you decided to go with one of these plans that gives you these extras, by all means, it'll save you money. The value is there. But let's just kind of talk a little bit more about the dental first. Okay, now to me, your dental plan is one of the most valuable tools that you can purchase from Ameriplan. Why do I say this? One person, it covers for $15 a month. A household, a family, it covers up to 10 people for a household for $20. Okay, that's 10 people. The price doesn't change. Unlike health insurance, more than one person, you're going to get charged a monthly premium for each person. Okay, let's do a breakdown. There's no paperwork, no insurance companies. A real toll-free number to call and find out in terms of network providers, or you can go here and type it in online. No waiting period, unlike traditional dental insurance. Sometimes it varies from a 3-month window to a 6-month window in terms of waiting periods on traditional dental insurance plans. Okay, dental insurance. Let's talk about this. What this dental plan covers, and it's kind of a 4-in-1 deal. You have dental, vision, prescription, and chiropractic. Okay, your dental, once again, up to an 80% savings on your dental. Okay, you have over 30,000 providers you can choose from, between 25 and 80% savings. Okay, you get savings on braces, oral surgeries, root canals, gum treatment, and kids dentures. Dental works. And all ongoing dental problems are still covered. Okay, let's talk about vision. More than 12,000 providers under our dental plan. All your big names: Lens Crafters, Pearl Vision, Sears, J.C. Penney's. Your savings on frames, lenses, if your lenses will be tinted, and all other savings, contacts. Okay, so ladies and gentlemen, it points out what the features and benefits, coverages, what they are. Now, prescription. Over 56 retail pharmacy locations across the U.S. What do you see? Who do we cover? Your major pharmacies. Walgreens, CVS, Walmart, Target. Okay, ladies and gentlemen, these are your coverages. You have up to an 85% savings on brand name and prescription generic drugs. This also gives you a wonderful breakdown, ladies and gentlemen, as to what else it covers. Okay, it just breaks it down, and this is a great tool. Chiropractic. Now, this is a tool that I believe is valuable. Why? Because let's say you have health insurance, you're going to have to pay that deductible, your overall health insurance deductible, in order to take advantage of chiropractic services. For example, if you were to have back problems, if you have traditional coverage under Humana, Aetna, any of the big names that we do work with, you're going to have to meet the overall plan's deductible. You're going to have to meet the deductible for that particular plan. Okay? If you do not meet that deductible, you're not able to take advantage of chiropractic services. Okay, so and that's if it's even covered. So we just save you the headache. You just go. You have this plan. You just show your card, and you see the savings that what happens under the chiropractic benefit. Okay, so this is what happens. This is one of our popular plans. Okay, now in terms of our Medical Plus plan you get here, it's not as valuable in my opinion, this plan here, as this. But you still get a Meridoc. Let's just say you didn't care about having all this, and I think for a couple bucks less, to me, in my opinion, it's not worth it. But for $2 less, if you just want a prescription, you can get that, and then you can have an on-call doctor, meaning a Meridoc. You just call on the phone and have an advisory physician on the phone, that will, you give them the problem, they will try their best to help you with the solution. Okay, so again, but to me, this is not as valuable as this plan, because you have 4-in-1, and it's $2 less. Why would you get this plan? Now, like I told you, that we're going to touch on to me the most two important products, which is this dental, okay, Dental Plus, which includes 4 benefit features, and it lists your coverages. And just take your time, and you can definitely come back here at your leisure and review the coverages. Now, let's talk about the actual medical plan benefit. With all the benefits that we listed here, okay, all the benefits that we listed here. And let me do something here real quick, because I know I want to touch on this. Okay, alright, I'm going to touch on that in a moment. Now, all these wonderful benefits here, and the coverages that it lists. We're going to take it on down to here as well. So as you see, with all features of Ameriplan Dental Plus, including the AmeriDoc, this person is able to have physician services, laboratory services, imaging services, physician services, mental health services, and diabetic supplies coverage, okay? And then also, you're going to have your major hospital, okay? This gives you hospital benefits, okay? This also covers any type of primary physician services. You can go to the doctor with this service. You can go to any specialist with this service, okay? So anything that you had covered under your traditional insurance, this will still cover the same type deal. It's just covered differently. It's a discount plan. So you're able to have all your major inpatient, outpatient deals with this type of service, okay? So you can go to the doctor office, you can utilize this plan. That's what it's built for, okay? Now, these are the type extras that comes with the plan, all right? In addition to what you have here in terms of all your Ameriplan healthcare, in addition to the Dental Plus benefits that is all combined under this one plan, all right? So if you were to get something extra for $50 a month, you can have this, including everything you see here, okay? So the main part of the tutorial is really just to talk about the important benefits of the Ameriplan deal. You can go here, look at every single deal. Let me see if there's something else that we can touch on. Yeah, it just brings me back to the same I'm sorry. It brings me back to the same page in terms of the benefits and coverages. So when you get a chance, just view this website, ibourl.net/health benefits nationwide. Okay. So again, let's kind of touch on here a little bit what you'll see. If you have questions or you want to go ahead and get started yourself, by all means. If you have an online application. In the press, it talks about, you can look at what the press is talking about, what is going on in media, the news, what they're saying about Ameriplan. Programs side by side. Again, it brings you back to what programs we have here, coverages. Simply click on more info, and it breaks down. Ladies and gentlemen, this plan right here, I'm sorry, if you hear the enthusiasm in my voice, this is just something I'm excited about because an individual can pay $15 a month and take advantage of these services. This is just amazing and it's powerful. I'm not trying to sound cheesy. I hope I don't sound too lame, but just what I've done in the traditional health insurance field, this is why I adopted these products, because of the value that it has. How you're able to help a person. Again, one person, $15. These wonderful benefits. A family, $20 for up to 10 people, ladies and gentlemen. That's what this plan is made for. That's why I'm excited about the value that it brings. And then again, what you're talking about, the major health, it tells you here, it gives you your hospital, it tells you what's going to happen, what's covered, your coverages. It doesn't give a whole lot of coverages in terms of the doctor's office, but however, it's covered. Why is it covered? Because we have providers that work with us. Okay, so you have your urgent care, you have your primary care physicians, and your physician specialists. So we cover those primary doctor type benefits. Okay. Just go back. Okay. But yeah, I hope this tutorial is helpful. I hope that it kind of goes over a little bit more in detail. Let's see what else. Again, if you want to look at testimonials, you can. It'll give, again, what a member saved. These are actual members, ladies and gentlemen. This is not made up. These are not individuals paid. These are not false information. We receive, oh wow, we receive emails from the home office for Ameriplan, always talking about what was covered and how much they had saved. Let's see, facts and questions. This is a good one. You know, who is Ameriplan? How do I use the plan? What is the waiting period? Ongoing dental medical problems included, meaning your what are we talking about? Like pre-existing conditions. What is not covered under a major health insurance plan? Okay. And as you see here, it tells you $19.95 for the dental plan, dental plus plan. That's the membership. That's the members, the household. So you click on the question: is maternity included? See, all medical needs are included as long as you have a contracted provider offering the service. Okay. You can get help with maternity. Are you serious? That's problem serious. That is powerful. You can always downgrade. His lab facilities, a lab at a regular doctor's office, is that covered? Now, this cannot be used in coordination with any type of Medicare plan. So if you're on Medicare and you purchase this plan, keep it separate. How is rates discounted? The rates that the provider charges are determined upon a set fee schedule that the provider has contracted or as a percentage off of their billed charges. In general, discounts vary between 20 to 50%. Labs and diagnostics saves up to 80%. Hospital benefits. Can you briefly describe the hospital advocacy program? The hospital advocacy program is designed to help members with their medical bills whenever a single hospital visit totals $2,500. Okay? For the insured, this means the amount you are personally responsible for aside from your deductible. However, this plan has no deductible. It's just giving you an example in terms of the traditional health insurance mindset. So, again, just take time to review these. They will negotiate your benefits with you. Now, can this be used in conjunction with health insurance plans? Yes, but it's up to the physician, the provider discretion whether to accept both. As with our Dental Plus program, a member's insurance should always be the primary form of payment. Okay, so in a lot of cases, just do not mention your health insurance if you have it. Okay, I've had situations where the client mentioned I had health insurance and this, and if this one physician took both, another physician didn't take both. So I just want to be honest up front. We have nothing to hide here. So, it can be used, but try not to go into the situation being double armed. Just, decide which one you're going to use first. Okay. This kind of gives you a little bit more about benefits and services. And these are things that you can always read on your time. This is a live screen here, ladies and gentlemen. So, what I'm giving you is real time, nothing bogus. So I hope that this was a helpful tool for you. I hope it was helpful. I hope that maybe, we talked about the coverages a little bit more in detail. As we go back to the program. So again, to me, in my opinion, this is a wonderful tool. It breaks down coverages, keyword coverages. Let's make sure that we utilize and read it correctly, just so you can understand what it entails. Okay, most ongoing medical problems are included. All right, ladies and gentlemen, I hope this was helpful. If you have any questions, I'll have information below this video. If you want to reach out to us, you can always just type in this website. Okay, you can go here, do a live chat. You can come back here. Okay, just leave us some information, or you can give us a call at 630-551-8271. Okay, just give us a call, talk with us, or if you don't want to, talk on the phone, you can leave information here, and one of us will get back with you. Just make sure to type this in your address bar, and use whatever method you feel is important to you, and we'll get back to you. Okay, have a good day. And then what I'll do is play this video, and then I'll go ahead and end the video.
Welcome to Ameriplan. We are one of the nation's largest discounted fee-for-service healthcare benefit programs, and since 1992, we have saved over 1.5 million members more than $1 billion.
If you're looking to save money on your family's medical, dental, vision, prescription, and chiropractic expenses, you're at the right place at the right time.
Ameriplan is not insurance. We are the smart alternative for the uninsured and underinsured.
As a leader of the massive movement in healthcare called consumer-driven healthcare, we're changing the way people get the care they need on a variety of important services. Medical, dental, vision, prescription, chiropractic, physician, x-ray, lab, hospital advocacy, and more.
With thousands of healthcare providers in our network all across the country, in big cities and in small towns, we are almost everywhere. I saved $94 on the glasses I'm wearing right now.
Bill was over $700. I saved over $288.
With the co-pays, my insurance was going to be $30. Regular price was $34, and we paid $17. So it's 50% savings.
The savings are great. The cost is low.
I was very pleased.
It's not too good to be true. It's an incredible program.
Walk in and present your card to them and watch the savings.
All right, have an awesome day. Be blessed.